Hi everyone, this is Dr. Zach Borus from Lakes Regional Healthcare and Dickinson County Public Health in Spirit Lake, Iowa, coming to you on the 24th of April with another coronavirus update. It's been a couple weeks since we've done one of these, but it had been fairly quiet around here, and I think that that has, for some of us, lulled us into a little bit of a sense of complacency. But we're starting to see numbers pick up. I wanted to give you a lay of the land in terms of what we're seeing here now, some of the outbreaks nearby, and where we are in terms of our response, our planning, etc. We'll also be doing a Facebook Live event sometime early next week. Details to be determined, but if you have questions, that'll be a great time to ask them. So just keep your eyes out for that. So where we are here. We are almost at 900,000 cases in the U.S., and that's confirmed cases. There are certainly more that have not been tested or have had falsely negative tests, but so we're probably over 1 million, and I say that fairly comfortably. The vast majority of those still are in the hot spots that we've talked about previously, so New York, Louisiana, Seattle, San Francisco, etc. But there are some rural communities and certainly more urban areas that are seeing upticks now because I think it spread very fast and it peaked earlier in some of these bigger cities than what we've seen in the center of the country. Here in Dickinson County, we have 5 confirmed cases as of today. One of those is the one that we had spoken about earlier, who has long ago recovered, and there's no one hospitalized with COVID-19 here in Dickinson County at this point. As you may have seen earlier this week, one of the cases was linked to our job site here at the hospital. Again, that is construction that's going on outside of the hospital building proper. It is still safe to be in the hospital, and we have shut down the construction site for a full 2 weeks to make sure that anyone who may have been exposed in that very brief window before the potentially exposing workers were sent home, so that anyone who were to have been exposed and potentially get symptoms will be able to show those symptoms and be tested and treated. We are hopeful that no more cases will come out of that, but we're trying to do our due diligence and be as transparent as we can about that. And certainly putting our schedules back and putting the construction on hold can have an impact on the community and on the overall construction project, but we thought it was the right thing to do, and hopefully at 2 weeks we'll be able to restart. The other 3 are linked to an outbreak that has been just over the border in Worthington. As you may know, there are 258 cases in Nobles County as of today, the vast majority of which are linked to the JBS plant, which has been shut down at least for the last 4 or 5 days. In Sioux Falls, as I'm sure you're aware, there's one of the largest outbreaks from a workplace in the country. I think as of today, I saw that there's over 800 cases directly linked to workers in the Smithfield plant, and then at least 200 from contacts from those. And so this is nearby, and it is here. So we've gotten lots of questions since we've started talking about wearing masks in public and trying to really continue social distancing. Especially, we were getting lots of questions when there was only the one case in Dickinson County as to why are we doing this? What do we need to keep staying away from our friends and our families? I think the answer, especially now, is absolutely yes. The reason that we've been so successful in keeping the numbers low is because people are staying home. It's because people are not having play dates between kids or big group visits with teenagers getting together and playing basketball. There's a reason why every single community in the area closed their playgrounds and their gyms and such. We are doing our darndest to keep people healthy and keep people out of the hospital and keep people from dying. And so, we feel very well equipped here at Lakes Regional Healthcare to take care of folks as they do become ill. And thankfully, we have a very good working relationship with Avera in Sioux Falls, who hopefully will have capacity if we have severely ill people who are on ventilators and such to accept transfers. We don't know. So we are really trying to continue to flatten this curve. There are lots of folks who are saying, gosh, we need to reopen the country, we need to restart surgeries as soon as possible. You may have seen today that Governor Reynolds has said that hospitals are allowed to, if it fits their local criteria, allowed to restart some elective procedures with caveats. At this point, Lakes is not planning to do so because we see that this is just starting to build here, and that numbers are on the increase statewide, and I think it would be foolhardy to start doing things that will then bring people into our hospital and utilize resources that we might need for an upcoming coronavirus surge. Our models are still predicting a late May, early June peak for here in terms of number of cases. That may mean 50, that may mean 200, we don't know, but that's the number of hospitalized folks around that time. And so again, especially as that coincides with lots of snowbirds coming back, lots of folks whose kids are now out of school coming to their lake homes or coming to stay at the campgrounds here if they're open, we need to be even more vigilant, and we could become a potential hotspot. So again, as you arrive from elsewhere, we welcome you, but please be considerate of your neighbors. Please stay at home for a couple weeks if you are coming from a place that is more of a hotspot. Please wash your hands a lot and do wear a mask when you're out. Again, you wear a mask to protect the people around you, and they wear a mask to protect you. So if we can all be doing that, that will lower our contagion. Asymptomatic spread is real. So, a lot of these folks who are being tested outside of here don't have any symptoms. There was a study in New York on laboring mothers, and of them, they just tested every woman when they came into the labor and delivery unit at one of the hospitals. Of them, 22% were positive for coronavirus. 83% of those had no symptoms. And so we've gotten questions in the last few days from business owners and just local leaders. Gosh, is this here? Do we need to be really thinking that we need to be protecting ourselves? And the answer is, as it has been, absolutely yes. So again, if you are considering reopening your business, if it has been closed, make sure that you're still trying to make it available that you can do deliveries outside, do pickups, try to limit exposure as much as possible so that your staff and your other patrons can be safe. We don't know what the next couple weeks will bring in terms of the governor reopening gyms, health clubs, etc., but I think it's still going to look fairly different than it did previously, because I think all of our local businesses really want everyone to be safe, and so we appreciate that. We're working closely together with the Iowa Department of Public Health, Avera, the local EMS and local emergency management. We are doing lots of planning for if and when a surge comes. You may have seen a tent go up and down in the last couple days outside of our ER. It's just preparation in case we do have a high number of cases that we need to be testing a lot of folks or taking care of a lot of folks. We have the capability of turning wings of our hospital that have not been used for hospitalized patient care for a number of years back into patient rooms. We can do that. We have plans to do that. Test Iowa is a new program that Governor Reynolds spoke about yesterday. Gosh, it was just yesterday that she announced it, maybe 2 days ago. And they're offering the idea, at least, of drive-through, drive-up testing and trying to get more people tested. That's great, but there's lots of caveats. Right now, the only testing site that they're starting this weekend is going to be outside of Des Moines. And you still need to meet certain criteria to be tested. So there is a website called testiowa.com. I went to .org this morning, and that did not work. I did not qualify, but I wanted to see what the process was. It's quite slick. We would welcome expanded testing locally, but we are still following the Iowa Department of Public Health and CDC criteria here for who gets tested. It is still limited. Again, we still have not had to turn anyone away who met those criteria for testing based on lack of test availability, but some days it's sort of tight. So If you are feeling ill, if you have a new cough in the last 2 weeks, if you have a fever, if you know you've been exposed or you fall into a high risk category, then we still want you calling our respiratory hotline and getting triaged by a nurse. So that's 712-336-6696. And they'll tell you what to do, whether that's come in, whether that's stay at home and isolate, whether that's go to the ER because you're having true chest pain or can't breathe. They'll tell you what to do. Certainly, if it's an emergency, call 911. They will take care of you. Also, our clinics and our hospital are still open for business. So we are trying our darndest to change our delivery model, and we've seen quite a few folks via telemedicine, which is working out very well overall. There's a few kinks. We appreciate your patience with us as we work it out, but again, call your clinic number if you have an acute issue that needs to be seen, or if you're due for preventive care, we will be calling you if you had an appointment scheduled already and figuring out how the best way to do it is, whether that's virtually or in person, but we still want to get you in. We still want to make sure that you're staying healthy, because one of the side effects of coronavirus is that folks who have chronic illnesses are not necessarily getting the care that they always need, and that can lead to more ill folks having heart attacks and such, which are still obviously a major issue. We want to get you the care that you need, so call 712-336-2410 for Spirit Lake Medical Center, or 712-336-3750 for Lakes Family Practice. They all go to the same number. You'll be triaged by a nurse and figure out how and when you need to get in and who will see you. So, takeaways, it's here. We cannot let up our guard because I think we are going to start seeing more spread. The JBS plant was just this past week. Now those folks may live with people who could get sick, may have interacted with people that could get sick. If you have had close interaction with someone who has been identified as positive, you will get a call from the DPH. So you will get a call from local public health. So you do not need to call the hospital and try to find out who those people are. That's not anything that we are capable of sharing. It's limited what we can say, period, about any of these patients, because obviously privacy is still key. But rest assured that if you have been in close contact and have been identified as a potential exposure from one of the folks who is a known positive, you will be called by the Department of Health and checked for symptoms, and so be aware of that. So please don't start play dates. Please don't start having group get-togethers at homes. Please don't be playing basketball, wrestling, etc. in parks or in front yards or otherwise. Please do get outside and walk and socially distance and stay 6 feet away from folks who are not in your immediate family or who live with you. And please continue to take care of your neighbors. Please continue to be vigilant. We will get through this together. Thanks for your time. I look forward to seeing you on Facebook Live next week, and let us know if you have questions or concerns. Thanks so much.